with Dr. Parija, author of Textbook of Microbiology and Immunology. Dr. Parija is a Dean, Research Wing, and Senior Professor, Microbiology at the prestigious Jitmer Institute, Pondicherry. The topic of discussion today is laboratory diagnosis of cholera. Uh, Viewers, you can post your queries on our Facebook page, facebook.com Elsevier India, and we will take on your queries after Sir has given his lecture. So moving on to Sir, Sir would start his lecture now. Okay.
Good afternoon. Welcome you all.
Good afternoon.
Good afternoon. Welcome you all to this Google Hangout. At the outset, I take this opportunity in thanking Elsevier to share some of my thoughts on laboratory diagnosis of cholera. As we know that cholera is a infectious disease caused by bacteria Vibrio cholerae. It is a disease caused by toxin of the bacteria. We call it one of the example of a toxin-mediated disease. The seriousness of this cholera is that it causes lot of fluid loss from the infected humans. As a result, the fluid loss is so much that the person suffers from severe dehydration. Hence, if we don't diagnose the case earlier, if we don't start specific management, the cases of cholera may be associated with increased mortality and morbidity. In this scenario, laboratory diagnosis plays an important role for specific detection and identification of Vibrio cholerae. There are two objectives in laboratory diagnosis of cholera in a microbiology laboratory. In the first stage, we try to isolate the suspected Vibrio cholerae from a stool specimen, and after we isolate the suspected Vibrio cholerae, we try to identify whether it is a classical Vibrio cholerae O1 Vibrio or the newly emerging bacteria that is non-cholera Vibrio cholerae O1 phenine. So to proceed for laboratory diagnosis, as we know, in any diagnosis of any infectious disease, the accurate collection of specimen is most important. So in diagnosis of cholera, we have to collect the specimen, most preferably the stool specimen, direct stool specimen, that is to be collected before the start of antibiotics. That is one most important component we must remember. And this stool, direct stool, is collected in the sterile container and sent to lab for processing. In case if we don't have a direct stool specimen, particularly in the patients from the convalescent patient and other patients, we can collect the stool through the sterile rubber catheter. That is another method followed for collection of the stool specimen. And sometimes we can also collect stool specimen by use of rectal swabs. This collection of stool specimen by rectal swab is often recommended for the patients of cholera convalescing after some time. Now, in diagnostic approach for laboratory diagnosis of cholera, we do recommend the collection of specimen either by stool or catheter stool or by rectal swab, but we never recommend the collection of the specimen, that is the stool specimen, that is from the bedpan. This is the specimen we never recommend for examination for bacteria. We also don't recommend the examination of vomitus of the patient for demonstration of the bacteria. The moment this stool is collected, next step for diagnosis is that we have to transport it to the laboratory where there is facilities for isolations and identification of the bacteria. Stool, the main important dogma behind this laboratory examination of stool specimen for Vibrio cholerae, it should be sent immediately to the lab, so that any viable bacteria which is there can be grown and can be isolated. If there is a delay, if the patient is in primary health center or district health center or away from the lab, then obviously it's recommended the stool specimen should be collected in transport medium, enrichment medium like alkaline peptone water, and transported to the lab within the 3 to 6 hours. And sometimes, if there is a long delay, even specimen can be preserved in Calera transport medium and sent to lab within 3 to 6 hours for processing. And sometimes, if there is this alkaline peptone water or Calera transport medium are not available, the simplest method can be you can soak a piece of sterile piece of filter paper, blotting paper, in the stool, and send the same in a plastic container and send to the lab. The moment the stool specimen, whether as such or sent in the enrichment medium or sent in the blotting paper soaked with, comes to the lab, our main thrust is to detect the bacteria. In a microbiology lab, as all of us know, we follow two approaches. First, we try to detect bacteria by direct microscopy, and second, we also try to detect bacteria by culture. This so in this situation, people have attempted and also being used, direct microscopy was being used for demonstration of bacteria Vibrio cholerae directly in stool specimen. People have used dark field microscopy. It was a useful method to demonstrate typical darting motility of Vibrio cholerae in stool specimen. And also, we used to add specific antisera and look for the inhibitions of the motility. That used to give a good clue by direct microscopy about the possibility of the bacteria as Vibrio cholerae. And many people also have evaluated direct immunofluorescence microscope for direct demonstration of Vibrio cholerae in stool specimens. But nevertheless, these two methods, either by direct demonstration by this dark field microscopy or direct fluorescence microscopy, is not that so good, excellent method. It's not that method of choice. So, in the lab, our diagnosis rests on the isolation of the bacteria by culture in selective media. We do have, for the culture of the bacteria by growth in the media, we do have set of media. So, for this process, what we do, when we receive the specimen in the enrichment medium like alkaline peptone water, or from the fresh stool specimen, we can inoculate in the alkaline peptone water and incubate at 37 degrees centigrade for 4 to 6 hours. Then after incubation at 4 to 6 hours, we have the subculture on two sets of media. For Vibrio cholerae, we use two groups of media. Another is non-selective media. PCBS, that is, and DTA are the two selective media used for isolation and culture of Vibrio cholerae. In addition to that, we can also inoculate simultaneously on McConkey agar and blood agar. And we incubate these sets of place after inoculation overnight at 37 degrees centigrade. Then overnight, if the bacteria is suspected is Vibrio cholerae, then on PCBS, after overnight incubation, it produces sucrose fermenting yellow colonies. So with this suspected yellow colonies, then in our lab, we go for the traditional methods of identification of this Vibrio cholerae by performing the traditional test. By gram staining of the colonies, we can see typical coma-shaped gram-negative bacilli, and we we do put a set of fermentation reaction of these sugars, like fermentation forms glucose, sucrose, maltose, etc., with production of acid, but it never produces gas. It definitely catalyst positive and oxidase positive. It utilizes lysine, it utilizes ornithine, but not arginine. So all these characters are taken help of to identify it is Vibrio cholerae or not. After we presumably identify is Vibrio cholerae or not, then the main second stage is to serotype it, because we have to do we have to know either this is a Vibrio cholerae O1 or non-cholera vibrios or non-agglutinable vibrios. To know it is Vibrio cholerae O1, that is classical Vibrio cholerae biotype classica or biotype alter, we have to do agglutination test with specific antisera O1. If this colony suspected to be Vibrio cholerae agglutinates with O1, it indicates this is a O1 cholera vibrios. Then if it is positive, then we agglutinate with Inava and Agua syrup for serotyping. But suppose when we do first slide agglutination by testing with O1 antisera, if the suspected Vibrio cholerae does not agglutinate with O1 antisera, then we have to repeat agglutination at least with 5 more colonies. Still, if it is negative, then we have to test with H antigen, antisera with H antigens, and again we have to test specifically against antisera with O139. After testing antisera with O139, if it is positive, then we can tell it Vibrio cholerae O139. As all of us know, Vibrio cholerae O139 is a non-cholera vibrio or is a non-agglutinative vibrio which causes cholera disease in humans. No other cholera vibrio cause disease, no other non-cholera vibrio cause disease other than Vibrio cholerae O139. When we have identified either as Vibrio cholerae O139 or Vibrio cholerae O1, when we have identified Vibrio cholerae O1, then we have to do biotypings. Vibrio cholerae O1 has two biotypes, biotypes alter and biotypes classical. There are set of tests in the lab which are used to differentiate these two biotypes, that is biotype alter or biotype classical. Typical tests which are performed to differentiate between these two biotypes is, for example, hemolysis of C. parvicis, 6-cell agglutinations, and VP test. All these three tests are positive for Vibrio cholerae biotype alter, whereas these tests are negative for Vibrio cholerae biotype classical. Similarly, testing the colonies against polymyxin B antibiotics and susceptibility to a vibriostatic agent O129 and susceptibility to Mukherjee's phase 4, all these three tests are positive for Vibrio cholerae. These are Vibrio cholerae biotype classical. So in essence, we have got a definite set of tests by which we can definitely differentiate between these two tests. To summarize, we can have 6-cell agglutination positive, 6-cell hemolysis test positive, or VP test positive for Vibrio cholerae biotype alter, whereas polymyxin B sensitivity to vibriostatic agent O129 and sensitivity to Mukherjee's phase 4 are positive for biotype classical. This will be enough for the clinicians for the treatment purpose. But sometimes, if we want to know the exact phase typing of this Vibrio cholerae, either biotype or classical, this can be done at the reference centers. For example, in India, we do have a National Institute of Cholera and Enteric Disease at Calcutta, which is center for Vibrio cholerae phase typing. They will tell you the strains bacteria which you have isolated belongs to which type of phages. Then here in diagnosis of Vibrio cholera, we do have sometimes problem for diagnosis of carriers. For diagnosis of cholera carrier cases, we have to do repeat culture of stools. This is because unlike acute infections, in cases of carriers, the volume of the bacteria excreted is less. Sometimes we can also demonstrate stool after administration of purgatives like mannitol and look for the bacteria. And sometimes we can take bile or by intubation and can also examine for the bacteria. In diagnosis of cholera, serodiagnostic tests have very less important role. They are not used for the diagnosis of the cases, but they are used for the seroepidemiological studies. In essence, laboratory diagnosis is most crucial for specific treatment and management of the cases of cholera. And it depends mostly on the culture, isolation of the bacteria by culture. After isolation of the bacteria by culture, we want to know whether it's a Vibrio cholerae O1 Vibrio or non-cholera Vibrio O139. If it is Vibrio cholerae O1, we want to know whether it's a biotype classica or biotype, and that should adequate for the treatment and institutional therapy. Thank you very much. Would you like to ask any questions?
Thanks, Dr. Parija, for a very interesting lecture. Now we have some viewers' queries that we'll take one by one. The first question is, how should the stool sample be preserved if we are expecting some delay in transporting?
That's the question, because obviously delay is a common problem, and the best method to maintain the viability of the bacteria in case of delay while it comes to lab, we always recommend for inoculation carry layer transport media. That's a good method to preserve the bacteria.
Okay, sir. Sir, another question is, what is the current role of direct microscopy for diagnosis of cholera?
As I mentioned, there are ways to demonstrate by direct microscopy. One is by demonstrating direct motility of the bacteria in the dyed stool, or perform dark ground microscopy to demonstrate motility, or see inhibition of the motility by adding specific antiserum. But sometimes we don't recommend this as a method to confirm the diagnosis, and sometimes it's not that a confirmative method for diagnosis.
Okay, sir. So next question is that what media should be used for plating stool sample from a suspected case of cholera?
Yeah. The most selective medium used worldwide for plating stool samples for Vibrio cholerae is TC-based medium. Thiosulfates and lysosulfate.
Okay, sir. Sir, another question from our viewer is important test to differentiate the biotypes of Vibrio cholera?
Yeah, that's what I told. Because there are two important biotypes. There are two biotypes only. We call it Vibrio cholerae biotype classical and Vibrio cholerae biotype elder. As I mentioned in my talk, there are a set of tests which can be used to differentiate Vibrio cholerae biotype classical from those of elder. For example, sieve cell hemolysis test, chick cell agglutination test, and VP test. All are positive for Vibrio cholerae biotype elder, whereas they are negative for Vibrio cholerae biotype classical. Similarly, sensitivity to antibiotics polymyxin D, sensitivity to vibriostatic agent O129, and sensitivity to Mukherjee's phase 4 are all positive for Vibrio cholerae. There is a standard method to differentiate between these two biotypes.
Sir, we have a new question that has come up. How should the stool sample be transported, sir?
Yeah, stool samples best way is to transport by alkaline peptone water or VR transport medium, so that they maintain their viability.
Sir, we have a question related to your book, sir. It says that is your book meant for undergraduate or for postgraduate students, and what are the salient features of the book?
This book is meant for both undergraduate students and postgraduate students. Both the group of students will find this book to be most useful. It has got many salient features. First and foremost being, it is written in simple, easy to understand English. Our Indian students will find it more convenient to read it and understand it. Second important feature of this book is that it contains all the recent information, advances on various aspects of pathogens, including bacteria, viruses, and fungi. It gives a good understanding in understanding the immunology and general microbiology being taught for MBBS students. Third thing is that in this book, for important informations, for example, the development of vaccines, virulence factors of the bacteria, and pathogenesis of the disease, we have included in the box item. We are given specific tables, and we have given some key points, so that the students, it will be easier for the student to understand what is more important. And the most important feature of this book, I feel, in bacteriology and virology, at the end of every chapter, we have given clinical case studies. Because now the concept in teaching microbiology, what we used to teach 20 years back and now is completely different. Now it's clinical microbiology. We want the students to apply their knowledge in microbiology in clinical scenario and clinical setup. I think these are some of the salient features of this textbook of microbiology and immunology.
Okay, sir. So we have a question here from a viewer regarding what are the strengths of your book and how is it different from other books that are there in the market?
Yeah, that's what I mentioned. My book deals with the clinical aspects of the pathogens, the clinical microbiology, gives emphasis on the use and applications of the knowledge in microbiology in their clinical years. Number two, I have tried to emphasize most of the recent development in vaccines that has been taken place in infectious disease in each chapter. Moreover, students were always used to find difficult to understand pathogenesis of the disease. I have given specifically listed what are the virulence factors, for example, bacteria, and how it causes disease. If students understand this concept, he or she will be in a better position to understand the clinical manifestation of the disease and the strategies to prevent the disease.
Sir, in your book, have you covered the global data as well, or does your book just cover the Indian perspective?
Yeah, that's an interesting question, because when now the world is becoming short and short with access communicable to all, our student should know the magnitude of the disease in a global perspectives, as well as in comparison to global perspectives. They must know what is the prevalence of the disease in India. That is my two main objectives. So for this purpose, I have included in bacteriology and virology, in each chapter, under the subheading epidemiology, geographical distributions, I have clearly specified what is the prevalence of the disease in the world, followed by the prevalence of the disease in India. So it will help the students to know where we stand against the global prevalence.
Okay, sir. Sir, thank you so much for a very interesting and insightful lecture, sir. And before we wrap up, sir, you are the Dean of Research Institute. Sir, would you like to say a few words about what kind of research you are involved in?
GIPR is the Institute of National Importance in India. We do focus on the diseases, research related to diseases of public health importance in communicable as well as non-communicable diseases. This is our main thrust areas.
Okay, sir. Okay, sir. Thank you so much for your time, sir. And to our viewers, there are some more such interesting Google Hangout sessions that are coming up. So stay tuned with us for the next Google Hangout session on 4th of July with Dr. O.P. Kharbanda. And for more details, and if you want to have some, if you have more questions and you want to get the details of this lecture, please stay connected to us on facebook.com Elsevier India. Thank you. Thank you. Thank you, sir.
Thank you very
Thank
much.
you.
Thanks. Thanks. So nice.